What is a geriatric syndrome? Geriatric syndromes are common clinical conditions that don't fit into specific disease categories, but have a substantial implication for functionality and life satisfaction in older adults. Geriatric syndromes are often defined by isolating the shared risk factors associated with them, including older age, cognitive or functional impairment, and impaired mobility. Geriatric syndromes refer to multifactorial health conditions that occur when the accumulated effects of impairments in multiple systems render an older person vulnerable to situational challenges. Background and significance. Statistics. 1 out of 5 falls causes a serious injury such as a broken bone or a head injury. More than 1 out of 4 older people fall each year, but less than half tell their doctor. Each year, 3 million people are treated in emergency departments for fall injuries. Over 800,000 patients a year are hospitalized because of a fall injury, most often because of a head injury or a hip fracture. Risk factors include lower body weakness, vitamin D deficiency, difficulties with walking and balance, use of medicines such as tranquilizers, sedatives, or antidepressants. Even some over-the-counter medicines can affect balance and how steady you are on your feet. Vision problems, foot pain and poor footwear, home hazards or dangerous such as broken or uneven steps, and throw rugs or clutter that can be tripped over, and polypharmacy. Fall sequelae. Falls can cause broken bones like wrist, arm, ankle, and hip fractures. Falls can cause head injuries. These can be very serious, especially if the person is lacking certain medicines. Many people who fall, even if they are not injured, become afraid of falling. This fear may cause a person to cut down on their everyday activities. When a person is left active, they become weaker. Subjective data. Allergies. The patient has an allergy to penicillin. States she took it as a child and she had a rash following the dose. Past medical history. History of hypertension, hyperlipidemia, depression, anxiety, hypothyroidism, allergies to pollen and dust, and chronic low back pain. Social history includes tobacco use. States she smokes 1 pack of cigarettes a day. Denies alcohol and illegal drug use. Patient has been widowed for 2 years, lives alone in a 1-story house. Patient states that she has a daughter and a son that live within 5 miles of her, and another daughter who is 1 hour away. Current medications include lisinopril 20 milligrams PO daily for hypertension, lovastatin 40 milligrams PO daily for hyperlipidemia, Celexa 20 milligrams PO daily for depression and anxiety, levothyroxine 50 micrograms PO daily for hypothyroidism, Zyrtec 10 milligrams PO daily for allergies, and hydrocodone acetaminophen 5-325 PO BID PRN pain for chronic back pain. The patient is up to date on all childhood immunizations. She received a flu vaccine in October of 2018. Her last dental visit was 5 months ago. Her next appointment is scheduled Subjective data continued. Usual presentation. Patient typically presents to the clinic alone, walking without assistance of a cane, well-groomed, and evidence of good hygiene at home. Patient is typically alert and oriented ×4. She reports ability to complete all ADLs and IADLs. Current presentation. Today, the patient presents to the clinic for refills on medications. She is accompanied by her daughter. Patient alert and oriented ×4 and still reports she is able to complete all ADLs and IADLs. Patient states she has been feeling dizzy and weak. Reports dizziness is most common when she first stands up and lasts a couple of minutes. Patient information and complaints. EM is a 71-year-old female that has lived in Jackson, Tennessee for 71 years. She attended the University of Memphis and received a degree in education. She retired from teaching after 40 years in 2011. EM was married for 45 years and has now been widowed for 2 years. Source of information came from the patient. Chief complaints. The patient presents to the clinic for refills on medications. Her daughter states she has fallen 3 times in the last 6 months. She is concerned that her medications are making her weak and dizzy. Review of systems. General. Denies fever, chills, reports dizziness, weakness, and fatigue. Patient reports dizziness when first standing, denies visual changes, currently objective data. Orthostatic vital signs. Lying, blood pressure 134/86, heart rate 74, respiratory rate 16, temperature 99.1, O2 sat 99% on room air. Sitting, blood pressure 118/72, standing, blood pressure 100/68. Review of symptoms. General. EM is a pleasant 71-year-old Caucasian female, alert and oriented ×4, dressed appropriately, mood and affect appropriate, no fever, skin warm to touch, color normal for ethnicity. Eyes, Snellen eye test performed, 20th out of 30 vision with corrective lenses. Visual fields by confrontation tested, cranial nerve 2 intact bilaterally, cranial nerve 3, 4, and 6 intact bilaterally. Ears. No masses or lesions noted, skin intact, no pain on tug test, tympanic membrane visualized, cone of light visualized, pearly gray in color without erythema. Auditory acuity intact bilaterally. Head and face. Face is symmetric without masses or lesions, no involuntary muscle movement. Temporal mandibular joint has smooth muscle movement with no limitation or tenderness. Tenderness on palpation of maxillary sinuses. Transillumination of maxillary sinuses. Heart. No pulsations, thrills, or heaves noted. S1 and The following screening tools were used to assess the patient: Tenetti, gait, and balance. Balance 12 out of 16, gait 12 out of 12, combined score 24 out of 28. Get up and go test, initial score less than 20 seconds, which is mostly independent. Follow-up score, the patient answered 9 out of 13 questions with the S. Mini mental status exam, patient scored 30 out of 30. Patient shows no cognitive impairment. Home safety checklist. All living spaces, remove throw rugs, reduce clutter, use a nightlight, avoid floor facts and watch for spills. Ensure that phone can be reached from floor. Bathrooms. Use grab bars in shower and bathtub. Use rubber mats on shower floor. Install raised toilet seats. Outdoors, repair cracked sidewalks. Install handrails on steps. Install adequate lighting by the doorways and walkways. Diagnostics and labs. Labs include a urinalysis and a urine culture, a CBC with differential, CMP, TSH, B12, and vitamin D. Diagnostic studies include a chest X-ray to assess for lung expansion, EKG or echo due to reports of dizziness, X-ray of affected body parts to assess for breaks or damage from fall, bone densitometry to assess for bone strength, CT or head if any reports of a head injury. The assessment includes gait, balance, mobility, ability to perform ADLs, blood pressure, heart rate, rhythm, vision, muscle strength and tone, reflexes, review of meds and alcohol use, footwear and foot health, diet, pain, joint stiffness and arthritis, new or chronic illnesses, fear of falling, memory and brain function, risk in your home environment. Differential diagnoses include vertigo, arrhythmia, and anemia. Vertigo is the sensation of feeling off balance. This is caused by inner ear problems. Typically, vertigo is triggered by rapid movements of the head. Symptoms associated with vertigo include spinning, swaying, unbalanced, nausea, vomiting, nystagmus, headache, tenosis. Diagnosis includes clinical history, physical and neurological examination, blood tests, and imaging tests such as CT scan and MRI to rule out other serious conditions such as stroke or tumor. Falls are common in older adults with falls due to increased dizziness and balance disturbances. Vertigo is ruled out mainly due to clinical history and physical, negative for nystagmus, tinnitus, nausea, and vomiting. An arrhythmia is an abnormal heart rhythm where your heart beats too fast, slow, or irregularly. Symptoms of an arrhythmia include feeling faint, dizzy, or lightheaded, shortness of breath, regular pulse, or heart palpitations, chest pain, pale skin, or sweating. Causes of arrhythmias include change in your heart's muscle after illness or injury, healing after a heart surgery, low potassium and other electrolytes, abnormalities of the heart, medications such as beta blockers. Patients with arrhythmias are at increased risk for falls because of dizziness and shortness of breath, as well as syncopal episodes. Arrhythmia is ruled out due to an EKG showing normal sinus rhythm and lab results without any electrolyte imbalances. Final diagnosis: orthostatic hypotension. Patient is experiencing falls because her blood pressure is dropping below the normal when she stands, therefore causing dizziness and causing her to lose her balance. Symptoms include dizziness or lightheadedness, feeling about to faint, passing out, or falling, headache, blurry vision or tunnel vision, feeling vague or muddled, feeling pressure across the back of your shoulders or neck, feeling nauseous or hot and clammy, weakness or fatigue. Causes include high blood pressure, diabetes, heart failure, taking some diuretics, antidepressants, and medicines to lower blood pressure, neurological conditions like Parkinson's disease and some types of dementia, dehydration, vitamin B12 deficiency or anemia, alcoholism, and prolonged bed rest. Risk factors include standing and sitting up suddenly, in the morning when the blood pressure is naturally lower, after a large meal or alcohol, during exercise, when standing on the toilet, when you are ill, if you become anxious or panicky. Treatment of orthostatic hypotension. Get out of bed slowly. First sit up, sit on the side of the bed, then stand up. Take your time when changing positions, such as getting up from a chair. Try to sit down when washing, showering, dressing, or working in the kitchen. Exercise gently before getting up. Move your feet up and down and clench and unclench your hands, or after standing, march in place. Make sure you have something to hold on to when you stand up. Do not walk if you feel dizzy. Drink 6 to 8 glasses of water or low-calorie drinks each day, unless you have been told to limit your fluid intake. Avoid taking very hot baths or showers. Try sleeping with extra pillows to raise your head. If the following steps to reduce orthostatic hypotension do not work, adjustments to the patient's blood pressure medicines will have to be made. Challenges and barriers. The biggest challenge in caring for the elderly is getting them to be honest with their health. Many older adults are afraid to admit they have fallen or that they have a decreased mental function. Educating older adults about the importance of being honest with their health is very important so that hopefully we can better manage their care. Community resources. A social service consult would be beneficial to this patient to go to the patient's house and help carry out the home safety checklist. This would be beneficial to the patient in the event of a fall to ensure that she decreases the risk of falls, but also ensures that the patient has the ability to get help in the event a fall does occur. Multidisciplinary team. The nurse practitioner's role in this patient's care is provider and educator. Collaboration includes the nurse practitioner student, preceptor, and the lab. Interdisciplinary collaboration between the nurse practitioner student and the preceptor to discuss diagnosis and plan of care. It is not necessary at this time to refer the patient for further testing or higher level of care. Polypharmacy and falls. EM is at an increased risk for falls because she is on multiple medications that have side effects that cause dizziness, blurred vision, lightheadedness, and weakness. Education needs to be provided about the side effects of medications that increase falls and prevention methods such as the use of a cane or walker, rising slowly, and activity modification while taking these medications. Patients should also be aware of the complication that falling can create, such as broken bones, head trauma, and decreased functional ability in the future. Falls in the elderly are common and can cause significant physical and emotional harm. Polypharmacy has been shown to increase the risk of falls in older adults, even after adjustment for age, disability, types of medication, and comorbid conditions. The medication that EM is currently taking that puts her most at risk for falling are lisinopril, citalopram, levothyroxine, cetirizine, and hydrocodone. Benefits of lisinopril for hypertension. ACE inhibitors are proven to treat hypertension by interfering with the renin-angiotensin-aldosterone system. Due to the changes that occur in the large arteries because of aging, systolic blood pressure after the age of 50 increases with every year of life by about 2 and diastolic blood pressure by 0.5 to 1. In a study completed by the Journal of Academy of Medical Sciences, the efficiency and safety of lisinopril was tested on older adults aged 65 and older. After the 12-week stud, blood pressure was significantly reduced by lisinopril treatment, and there was no significant drop in the heart rate, and postural hypotension did not occur. This is important in the geriatric population because postural hypotension is a huge risk factor for falls. Discussion. Health behaviors identified in this patient are depression and anxiety, because this affects how she manages stress and carries out daily living. The main social determinant this patient faces is housing safety. As determined by the housing safety checklist, there are many repairs that need to be made at home to improve the quality of her living condition and decrease the risk of fall. The socioeconomic issues affecting this patient is her limited income. Although she is able to afford her medicine and living expenses, she does not have the extra funds to make the necessary repairs to her home that could prevent her from falling. There were not any legal or ethical issues involved in this case. Although this case study, I learned more about the effects of polypharmacy in the older adult. I am now more aware of the adverse effects medications can have on elderly patients and the geriatric syndromes that they are at risk for because of polypharmacy. I feel that I will be more aware of the patient's medical history and medication list, as well as which risk factors they are most at risk for.